Welcome back. City Meals on Wheels published a report titled Aging Without Hunger Ending Food Insecurity for Older New Yorkers by 2040. The data collected in partnership with the CUNY Urban Food Policy Institute reveals a food insecurity crisis among adults aged 60 and above. The COO for City Meals on Wheels, Rachel Sherrow, joins me to discuss solutions aimed at helping this demographic. Rachel, thank you so much for joining me.
Thank you for having me.
Now, as mentioned, food insecurity and hunger are affecting millions of New Yorkers, but right now there's an effort to end hunger among the elderly. Can you tell me a little bit more about that specific effort?
Sure. There are about 8 million New Yorkers throughout the five boroughs, and there are about 1.8 million of those who are 60 and older. So it's 20% of the population. It's a large percentage. And we know that there is food insecurity. We didn't know how deep until we undertook this important research. We looked at those who attend older adult centers, of which there are about 175,000 New Yorkers, and those who receive home delivered meals, one meal a day in their homes, and there are about 27,000 of those folks. So it's a smaller portion of that total 1.8 million, but what we were able to find was quite disturbing. Anecdotally, we understood that maybe people needed a little more, but what we learned was that 60% of those who receive the one meal a day in their home are food insecure, meaning that they need more than the one meal. And close to 50% of those attending older adult centers are also food insecure.
Now, the elderly are vulnerable to living in hunger due to physical and financial barriers. Can you detail some of the challenges facing older New Yorkers?
Absolutely. Those who are receiving home delivered meals are unable to shop or cook for themselves. 85% live alone. What we did find, which is very a very good statistic, is that close to 90% are very happy with the service. They feel that it keeps them living better in their homes safely and more healthy, but they do say that they need more. We do know that 65% of those who we surveyed live on $15,000 or less. 32% do not have Social Security, and 56% do receive SNAP, which is incredible. And we commend the city for their incredible work and their outreach. What part of the issue is that 55% do not even know if they're eligible. We have to reach these communities a little better with more education and destigmatizing receiving services like SNAP.
And I want to expand on SNAP. Are there any other challenges with this service that are causing a lot of older New Yorkers refraining from even, I guess, learning more about it or having to just know what is accessible to them in regard to SNAP?
Sure. I think there's misinformation. I think people believe that to recertify or even to get on the program is a hardship. It has been made much easier thanks to partially COVID and helping to take some of the onus off of the older adult. I think there's misinformation that people will be receiving less than they actually will. SNAP dollars help stimulate the economy within New York City, and it helps older adults and any New Yorkers with additional food that they could use.
Now, expanding on some of the challenges facing older New Yorkers, I understand that for many people, just cooking and dealing with groceries can be stressful. But I understand with older New Yorkers, it also kind of induces anxiety. Can you tell us a little bit more about the mental health aspect of, just not having access to the food that you need to survive?
Sure, it's a great question, and one I don't think we really understood. The anxiety that older New Yorkers face, even thinking about how to put some food items together or to cook or even think about where they're going to get their next meal, is very stressful. We do know that 41% can't even shop for themselves. Only 18% actually get groceries delivered. The others, are either unaware of the service, unable to access the internet. Only 25% actually use the internet. And we're looking at folks who are not utilizing benefits they may be entitled to, like SNAP. The mental stress to make a meal or to think about preparing a meal can then lead to just not eating. And that can lead, obviously, to malnourishment and hospitalization.
Now, as you mentioned a few times, many older adults rely on home deliveries and adult centers for food. But the number of adults relying on these services increasing, what impact is this having on the organizations that are doing this work?
Well, we're seeing a rebound in older adult centers after COVID, which is great. And for home delivered meals, there is a growing need because the population is increasing. What we need is, an infusion of support and funding. The Department for the Aging receives less than 1% of the total budget for New York City, even though the number of older adults is close to 20% of the total population. So there needs to be a right sizing in our society. We need to support our local officials in more funding and better infrastructure, and we need to support them in pushing the state and the federal government in infusing more funding into the city. The city spends a tremendous amount. The dollars are not equal to what the state and the feds put in.
And I definitely want to expand on that. I've done a lot of research on food insecurity, especially coming out of COVID or during COVID, and the amount of pantries that were filled with people, not just elderly, but everyone who needed resources, was so overwhelming. And I knew that definitely had an impact on a lot of those organizations doing this work. So I was really just glad to see that City Meals is trying to do some work to kind of address this issue head on. Now, I understand that City Meals believes that food insecurity for older adults can be eliminated through modernizing public programs. What does this mean, and what will it take to achieve that goal?
Well, that's one of our goals. We do think that we know that hunger is a solvable problem. City Meals on Wheels cannot do it alone. We are looking to partners, government partners, local community-based organizations, and just typical New Yorkers to help support this. Part of what we talk about in the study, in the research, is modernizing the current infrastructure of older adult centers and the home delivered meal program. That's going to take a lot of creativity and ingenuity, but many of the kitchens could be updated and modernized to produce more, or to be working longer hours than the typical 9 to 3, let's say, when older adult centers are open, so that we can offer meals at different times when maybe community members or older adults who are watching their grandchildren can bring them in for a later meal, things like that.
Now, another goal for the organization is to expand on the existing programs, but also launch new programs. Can you tell me a little bit more about that effort?
Sure, we will be launching some new programs over the summer, so we'll be excited to share that then. We will be expanding some of our current programs, like our mobile food pantry. Many of our recipients are unable to access food pantries because of the hours, or because they cannot physically get there or physically take the food home. We bring that food directly to them. We also want to expand our fresh produce program, which works similarly to those who just don't have access to fresh produce in their communities because of financial restrictions or geographic or physical issues. So some of those programs we want to expand so that everybody has food whenever they need it and they have healthy options.
Now, we're seeing a lot of work from different organizations, and even New Yorkers themselves have done things to kind of support those who are hungry, like the fridges on the sidewalk, and they'll put food in there, which are all amazing things. But what can New York City's elected officials do to ensure that fewer New Yorkers go hungry?
Well, we want to work with them to push the state and the federal government to renew and update things like the Older Americans Act, which talks about and has legislation on older adult centers and home delivered meals, making them more flexible so that there can be more meals delivered, or different hours for older adult centers to be open, things like that. And to really donate time and money to these efforts to a variety of different providers, including local pantries.
Now, Rachel, what resources are available to seniors that are currently facing food insecurity, and what are some steps that they can take?
Well, they can go to our website, citymeals.org, and look for some of the programs, but they could also sign up for home delivered meals. The City of New York, through the Department for the Aging, has a website where you can also look for services or where your local older adult centers are. And 311 is helpful for local food pantries as well.
Thank you so much for sharing that. I definitely think it's so important because I come from a community. Obviously, this is New York City, so there are elder adults everywhere, and I don't think many know that they can have food delivered to them. So, thank you so much for sharing that piece of information. Now, something that I do think is very important is that although we are looking to our elected officials to make change, there are things that New Yorkers, everyday New Yorkers, can do to help with this. So, how can viewers and even organizations support City Meals' effort to end food insecurity?
Well, again, they can go to our website, citymeals.org. They can volunteer time, money, or partnership. We would love to work with as many organizations as possible to make this happen, to end elder hunger by 2040. Again, we cannot do it alone. So we're looking forward to many new partners and those that we have been working with for many years to continue this valiant effort that we feel that really can be ended and solved by 2040.
And just to highlight the aspect of different organizations, are there any qualities of organizations that you look in that you would want to have, be on the team to help end food insecurity in New York City by 2040?
Well, you did mention being a New Yorker. Everything is local, politics is local, and so is community work. We'd love to work with organizations that really understand their community. Every community is different in New York, and we want to make sure that we reach people the right way, in the way that they want to be helped and can be helped and served. So it's really important to make sure that we're working with everybody throughout the five boroughs who understands their community needs.
Well, Rachel, I want to thank you so much for joining us and having this discussion.
Thank you for having us.
We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you miss any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios Channel 33, or watch anytime on the web at BronxNet.org. You can catch a brand new episode of Open with Darren Jaime on Wednesday and with Rena Valentine on Friday. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.